Namaskar. Today we will talk about the prognosis, that is the scope of treatment using homeopathy for the cases of cancers. I must say that cancer is a complex, difficult to treat disease as we all know, and it is such a disease which cannot be treated by any single mode of treatment. It cannot be always treated only by surgery or only by chemotherapy or only by radiation. It requires a combination of more than one modality in most cases. At the same time, one may also require homeopathy to be added as a part of the treatment protocol for practically all kind of cancers. My name is Dr. Rajesh Ushaha. I am a director of Life Force and I am a medically trained homeopath where we treat patients of all kind of chronic and recurrent diseases including cancers from practically all the parts of the world. My experience shared here is on the basis of the treatment experience of almost 400 plus cases of cancers of different types. In my experience, I would say that homeopathy has definitely a supportive role to play in the treatment of cancers of various types. I would like to clarify here that homeopathy alone cannot cure cancers. Nobody can claim that. There may be some scattered cases whereby some recovery may have happened only with homeopathy, but that is not what is recommended. Homeopathy has a supportive role and it must be exercised fully. What can homeopathy do for cancer? I would say homeopathy can do several things. Homeopathy can help treat and alleviate the symptoms of cancer. Cancer may present with symptoms depending on the site and the size and the stage of the disease, maybe like certain pains, discharge, ulcers, and other symptoms. Some of these symptoms can be definitely relieved with homeopathy. Homeopathy can also slow down the disease progression of cancer. Cancer being a progressive disease, it has a tendency to spread, grow more, and spread to different parts, what is called as metastasis. And homeopathy has shown clinically that this kind of disease progression can be controlled to a certain extent. However, we require more clinical trials to prove this. Third is some of the symptoms produced after the radiotherapy or radiation or chemotherapy. These symptoms could also be treated using homeopathy. The symptoms such as painful ulcers or loss of hair, weight loss, lowered immunity, frequent infections, diarrheas, etc., which are induced by chemotherapeutic drugs, that can also be reduced and relieved with homeopathic medicines. So homeopathy has a scope at multiple levels in the treatment of cancers. What is a good time to get started with homeopathic treatment? In my view, as soon as the diagnosis of cancer is established, one should think of an approach a homeopath for the treatment. Homeopathy could be started before the surgery or before the chemotherapy started. It could be started even if the patient is already on chemotherapy or radiation sessions, or it could be even started post radiation and chemotherapy depending on the case. Homeopathy is absolutely safe to take along with the allopathic medicines like chemotherapy or radiation. Homeopathy and allopathic medicines could be taken safely together without any adverse effects or bad effects. Sometimes patient may wonder, what if my allopathic doctor does not like me to take homeopathic medicine? Well, here there is no question of liking and not liking. Here is a question of choice. As a patient of cancer or as a family member of a patient having cancer, it is your choice. It is your right to use all possible modalities which could potentially help you treat cancer. Some people may ask, is there a scientific evidence that homeopathy can help cancer? Maybe I would say around 20-30 years back, there was no enough scientific evidence to prove that homeopathy is effective against cancer. Of course, there was huge clinical evidence and clinical experience of number of doctors of homeopathy who have presented cases of cancer getting relief using homeopathy. However, in last 20-25 years, there is a substantial data and scientific evidence suggesting that homeopathy can control the growth of the cancer tissue. Homeopathy can kill the cancer cells and reduce the tumors. Homeopathy can control the further spread or the metastasis of the disease. There are clinical trials, there are studies in vitro in the laboratory as well as in the animals. Our own study in collaboration with several institutions, I would say that my own work has shown significant potentials of homeopathy against cancer. We conducted a few studies in the laboratory model, in vitro model, in which we have demonstrated that homeopathic medicines have shown capacity to kill the cancer cells and to slow down the disease progression. We also shown in our studies that homeopathic medicines have anti-angiogenic effects whereby it controls the growth of the cancer tumor. We have also demonstrated in an animal study whereby we have shown that homeopathic medicines can reduce and regress the size of the cancer tumors in animals. And of course, there are other instances and evidences created by other scientists in India as well as outside of the country. Is homeopathy recommended for cancer? Yes, of course. As I said, homeopathy is very strongly recommended at practically every stage of cancer to get the best out of that. Homeopathy and the conventional medicine, they need to be integrated to give the best possible benefits and results to the patient. What is the duration of treatment with homeopathy? I would say there is no fixed duration. It all depends on the nature and the stage of cancer, but one must be prepared to take homeopathic medicine for a very long time. I would say at least 2 to 3 years, depending on the case. So now we have substantial data to suggest and support that homeopathy is scientifically effective against cancer. So I hope this information will help understand the prognosis of homeopathy in the treatment of cancers at various levels. Thank you very much.